Hi everybody, welcome to the Health How-To channel where we talk about some great life hacks and easy tips to achieve better health. In this video, we're talking about how to fix sciatica that causes back and leg pain. First, we'll talk about the reasons why we get sciatica, and then we'll get into 25 tips and tricks to cure sciatica. Please subscribe and share your best tips that you've found to be super helpful for fixing your sciatica in the comment section below. Pressing the like button will also help get the information to others. If you have someone in your life who you want to help, please share this video with them too. Also, remember that this video is purely for informational purposes and does not in any way replace any advice given by your own healthcare providers. If the exercises or information suggested aggravate your condition, please stop and ask your healthcare provider for further direction. So let's get straight to our topic of the day, sciatica. What is sciatica? Sciatica is an irritation or compression of the sciatic nerve that runs from your buttocks and can run down to your foot. The pain can feel like sharp, shooting pain, burning, electrical jolt, or numbness or tingling. You can think of sciatica as having a pinch on a telephone wire. A light pinch from a bent telephone wire can lead to static on the other end, or what you would feel as tingling, burning, or pain. A harder pinch on the wire can lead to silence on the other end, which you would feel as numbness, weakness, or your leg giving out. What causes the pinch? We can think of the spine as a stack of 24 blocks. In between each block is a disc that helps to distribute the pressure between the blocks, as well as pump out joint fluids to keep your spine lubricated. And they also act as spacers between the blocks. Between each block, we also have long nerves that attach to each of our body parts that receives and transmits information to the brain. Sciatica can be caused by poor posture over time. A highly arched back or flat back can cause prolonged compression on the nerve that exits between each block. Also, if you tend to lean to one side like in the car or on the sofa or carry things on your hip, such as bags or children, you can be prone to developing uneven weight distribution on your back and sciatic nerve. Even things like having a flat foot or one leg longer than another or a twist in your spine called scoliosis can lead to sciatica. Sciatica can be caused by thinning discs, which are a natural process of aging. When the disc is thin, it decreases the amount of space between the blocks of our spine and ends up pinching down on the nerves. Sciatica can be caused by bulging discs. Sometimes the discs can bulge out and be fine, and sometimes it can pinch onto the nerve after lifting or twisting suddenly when there's inherent weakness in the supporting muscles. Sciatica can be caused by narrowing of the tunnel where the nerve exits. When there is inflammation of the spine, for example, then the tunnel gets smaller and again pinches down on the nerve or irritates the nerve as we move. Because we know that which nerves are connected to which muscles, we can have a good idea of exactly which nerve is affected depending on where your pain is. This is why physical testing of your reflexes, mobility, and strength are a fast and fairly accurate part of early diagnosis. When your symptoms don't align with a particular nerve pathway, then further testing may be needed. If you're having changes with your bowel or bladder, go seek immediate medical attention. Who gets sciatica? About 80% of the American population will get back pain in their lives. 10 to 40% go on to suffer from sciatica. Workers in jobs that require repetitive bending have repetitive strain on their discs and spine. Overweight people have more pressure that goes through their low back, which causes more compression on the spine, discs, and nerves. Diabetics. Diabetes affects blood sugar levels, circulation changes, and can lead to nerve damage. Sedentary people. A lot of sitting causes abdominal and back weakness, known as core weakness, which affects the stability, muscle control, and structure of your back. Age. People between the ages of 30 to 50 tend to be the ones to get sciatica because our discs and posture changes gradually over time. By 40 years of age, our spinal curves may increase or decrease, which causes different pressure on the discs. Also, our discs tend to change from a jelly-like sponge with nutrient-rich fluid to a drier, less flexible hockey puck. Once the disc has become so stiff that it doesn't bulge or move that much, your risk of sciatica will decrease. Typically, by the age of 70, your back will be stiff, but at least you'll be less likely to get sciatica. The good news is that most cases can resolve within 6 to 8 weeks, but nobody wants to suffer needlessly. So here are the step 1, reduce the inflammation. Step 2, change your posture to unpinch the nerve. Step 3, increase your flexibility. Step 4, increase your core strength. And the last most important bonus step, step 5, do a backflip to celebrate being pain-free. Now let's get into 23 specific tips to help you get some back and leg pain relief. Tip number 1, use ice at the beginning, especially if you're experiencing back spasms. Try applying it on for 20 minutes a few times a day. Number 2, use a microwavable heating pad for 20 minutes, 2 to 3 times a day when your back is feeling stiff and sore. Number 3, at the beginning when the pain is at its worst, lie flat on your back with your legs up on a chair for 20 minutes. This position takes the most pressure off your disc and nerves. Number 4, once the pain calms down, keep moving. The worst positions tend to be sitting, driving, or standing for more than 20 minutes at a time. Try walking for 5 to 10 minutes every hour. Use shorter steps and keep your back and neck as straight as possible. Try not to rest for more than 1 or 2 days before resuming light activities. Number 5, consider using a back brace for short periods of time when you are doing heavier tasks around the house, going grocery shopping, or working a physical job. Number 6, try medicated ointments or lotions on your back and leg pain. There are a lot of brands on the market. Some are used to decrease inflammation, some are to help with muscle cramping, and some are used to help decrease pain. Keep a tube by your bedside so that you can apply it easily when you wake up in pain. Don't use lotions with a heat or ice pack though, because it can really burn the skin. Number 7, try medicated patches if you absolutely need to sit for a long time, like on a flight or long drive. Tip number 8, if your pain is unbearable, do consider taking an over-the-counter anti-inflammatory if you don't have stomach, kidney, or heart conditions. Anti-inflammatories can help with joint stiffness, inflammation, and arthritis symptoms. Examples include aspirin, Advil, Motrin, and Aleve. You can try acetaminophen, such as Tylenol, which mainly helps to decrease pain. Do consult your doctor if these medications don't alter the pain in any way. Because sciatica is a nerve irritation, your doctor may be able to help you find more appropriate ways to help you with your pain management. Number 9, try a percussion massage gun on your leg and back muscles, but avoid using it directly on your spine. Tip number 10, if you're overweight, even a 10-pound weight loss can really help put less pressure on your nerves. Tip number 11, sit up straight and try putting a pillow behind the small of your back. Number 12, get up more often. Don't sit for hours because it can lead to weak abdominals and back muscles and prolonged pressure and wear and tear on your spine. Tip number 13, although exercise can hurt at the beginning, stretching out back muscles that are short and stiff will help improve blood flow, stimulate healing, and distribute healthy joint fluid in the discs. Number 14, if you've injured your back from bending, lifting, or years of sitting or driving long distances, try getting into a gentle cobra position where you are on your stomach and press your upper body upwards as far as you can comfortably go while keeping your low back relaxed. Repeat them slowly 10 times, several times a day. Number 15, if you think your sciatica may have been caused from standing for long periods of time, for example at work or from sports, try bending forwards to stretch out your back muscles. Number 16, stretch out your piriformis with the lying figure 4 pose. Hold for 30 seconds. Number 17, do a spinal twist stretch. Lie on your back, bend both knees, and twist them to the side. Hold for 30 seconds, then repeat with one knee. Tip number 18, elongate your legs. Lie on your back and try to lengthen your leg one at a time. Hold for 30 seconds. Number 19, after the pain intensity has decreased, you can try stretching out your hamstrings. Number 20, good core exercises include planks, squats, supermans, and bridges. Increase your endurance by challenging yourself to do 30 to 50 repetitions. Tip number 21, work those glutes. The gluteal muscles in your buttocks are the largest muscles in your body. They are responsible for holding you upright and extending your hip to help you go upstairs or rising from a seated position. Sitting for long periods of time will lead to weak glutes and abs. When your glutes are weak, you can have trouble with rolling in bed, getting up from a low chair, and keeping your pelvis level when walking, which can eventually lead to sciatica. One of the best glute exercises is a side lying leg raise. A great functional exercise is to go up the stairs sideways. Tip number 22, try changing your sleeping position. If you're a side sleeper, put a pillow between your knees to keep your hips aligned. If you're a back sleeper, put a pillow under your knees. Check out some of our other videos for more tips on sleeping positions and mattresses. Number 23, re-examine your daily activities. This excruciating pain can come back if you don't take care of the cause. Think about bending with your hips and knees rather than the back. Change up your routines. Sometimes even using your non-dominant arm to do activities can lead to a whole shift in the way your body works. If you can, try to look up and reach up and back once a day, as well as doing a deep squat. Tip number 24. One of the most important tips is that our bodies were meant to move in different directions. The pain that you experience from sciatica can be frightening, but don't let it stop you from enjoying life in the future. Instead, use it as motivation to gradually get your spine flexible and strong. And finally, number 25, if you find that your pain is getting worse or that you really are incapacitated, you may need to see a healthcare professional like a physiotherapist to do some hands-on therapy to move the joints of the spine, loosen the tight muscles, and or release the trapped nerve. They will also be able to prescribe muscle rebalancing exercises and postural adjustments that are specific to your condition. If you have some great health tips that helped you to fix your sciatica, I'd really appreciate it if you could share them down below in the comment section so that we can all benefit in our personal journey to better health. Please subscribe and turn on notifications so you don't miss any health how-to videos where we talk about easy ways to improve your health. Also, please press that like button because it can really help get this information to those that need it. Thanks for watching, and I'll see you in the next video.